Cerebral palsy is a dysfunction of the brain which affects the movements and posture of the child as well as its mental development. The cause for cerebral palsy is damage in a child's brain before, during, or after birth. This can be due to lack of oxygen, infections, or lack of vitamins. Often the cause is unknown. Cerebral palsy cannot be cured, but we can improve the child's situation if we help it to move from early on and regularly in such a way that we can suppress its abnormal movements, and if we train its mental capacity and its capacity to express itself. This is the topic of this video. This video is not dealing with the therapy of cerebral palsy. Cerebral palsy can express itself differently in every disabled child. This depends on which part of the brain is damaged and how large the affected area is. The child may be deaf or blind. Its ability to move or its mental development may be affected, or all may appear together. Because of this, every child must be assessed individually. You have to keep in mind that the children can respond in very different ways to our treatment, and you have to observe their reactions very carefully in order to avoid causing them any damage. Movement disorders are easily seen immediately. Therefore, they often take up one's full attention, and then mental and sensory problems may be neglected or overlooked. To be able to assess the child's lacking development, we need to know how a healthy child develops. This depends on the normal growth of the brain and follows a standard development which cannot be changed or accelerated. This image shows how a healthy baby gradually develops more control over its body in the first 12 to 15 months, and then is able to stand up. The development of disabled children also follows the same sequence, though it may be delayed or incomplete. The first part of the body which a child can consciously move is its head. This is called head control. Then, control of other muscles develops further, continuing with the neck muscles down to the shoulders and spine, to the hips and legs. So, first the child is lying, then step by step it's able to sit, to crawl, to pull itself up, and finally to walk. One stage follows the other. Anyone who has seen a child grow up knows this. Despite this, we constantly try to go against this rule. For example, by putting children on their feet even before they can sit on their own. By doing this, we may cause serious damage to the child. Again, lying, sitting, crawling, getting up and walking. In order to learn new body positions and skills, the child needs time to feel its body in the new position and to learn the movement pattern. And it needs many repetitions to feel secure in this movement. This is the same for all children. However, disabled children need even more time and practice. We only have to remember how we felt when we ourselves, as children, learned to do something new, such as riding a bicycle. We were unsure, slow, maybe also afraid, and we had to practice many times before we felt safe and confident. This is also how a disabled child feels when it stretches to take an object, to sit, or to pull itself up in order to walk. The first part of the body which a baby can lift and move on its own is its head. So we start from here. Regardless of how old a child is, if it does not yet have head control, we start to play with the child while it is still in a lying position. Everything starts with the right posture. In this position, the child is not able to establish contact with others, to focus its eyes on faces or objects in front of it, or to grasp these objects. To improve the posture of the child, we put it onto its back, and while doing this, we talk to it in order to calm it down and to get its attention. In order to bend the child's body slightly forwards, we put a folded cloth or a small pillow under its head. We take care that the child is lying with its body in a symmetrical posture, that the arms are slightly bent and the legs are apart. Through light pressure onto the chest, we can stimulate the child to bend its body forwards. We check to see if its muscles are relaxed and if the child is comfortable. If the arms and hands are tight, one can try through outwards rotation of the arm and then of the hand to loosen the muscle tension. Now the child is ready to receive sensory input. We try to get the child's attention by talking to it, to cause eye movements with an object, and to stimulate the child to open its hands, even if, as in this case, the child is not yet able to do it. We can take both the child's hands and move them together rhythmically. We can also bring its hands towards its face, and while doing all this, we should always talk or sing to the child. When the child learns to take hold of things, we offer it objects of varying shapes, surface, size, and weight, so that it receives different kinds of sensory impressions. We should do this slowly and long enough, because disabled children need more time to experience motoric and sensory impressions. We turn the child to the left and right, or forwards and backwards. All movements are done very slowly and repeated again and again, so that the child has opportunity to experience how normal body positions feel, that is, to have sensomotoric experiences. We turn the child onto its stomach and take care, while doing this, that its body is still slightly bent forwards, and we put it onto a folded cloth. We take the shoulders and arms to the front. Through light pressure onto the lower back, we stimulate the child to lift its head. When the child learns to use its hands, it can begin to play independently in this position. In order to grasp toys and other objects, the child's shoulders and hands must be in front of the body. Also, this child is lying on its back with increased muscle tension, abnormally crossed legs, and stiff arms, so that eye contact and communication are difficult or impossible. As we cannot be sure how well the child can see, it is especially important to establish contact with the child through talking and touching. This, together with bringing the child into a symmetrical and, with the help of a pillow, slightly forwards bent position, is enough to relax the muscles of the child, to normalize its posture, and to make it feel comfortable, as we can see from its relaxed face and even its brief smile. Now it is ready for making contact and for sensory input. Always remember to observe the whole body and mind of the child. It is much more difficult to deal with children which have increased muscle tension and uncontrolled movements. But also here, we should talk to the child and try as much as possible to put it into a symmetrical and slightly forward bent body position. We try to open its hands so that it can take hold of objects. These children have a high risk of developing muscle contractures, which must be prevented at an early stage with exercises which will be shown later. As soon as the child can hold its head steadily, the next step is sitting. In the beginning, the backbone needs to be supported. First, the child sits leaning against the mother in her lap, or on the mother's thigh while being held against her body. In this position, the child has to adjust to the movements of the mother, and in this way, the muscles which support its spine are trained and strengthened. Care should be taken that the child sits firmly on both buttocks, that it's bent at the hip, that the legs are apart, and the back is straight. It helps to put an object between its legs, with which the child can also play. When it sits securely, the child can also play on its own with various objects, which will help it to practice its hand movements and mental functions. The muscles of the trunk are strengthened if we swing the child by its arms. As the back muscles are too weak, we do not pull the child up in the front by its arms, but instead at the shoulders and over the side. As one can see in the child's face, its muscles have to work hard when we swing it. This is very strenuous for it. So, we have to watch the child closely to see that we do not overtax it, and we must encourage and praise it. If we move the child on top of a ball, we must do this slowly and carefully, and make sure that the child is lying relaxed in a secure position on the ball. But its legs should not be stiff and crossed over each other. The child's shoulders and arms should be taken to the front. It is best if two persons hold the child, one at its hips and the other at its shoulders and upper arms, which will keep the child in a secure position. Under no circumstances should a stiff child be moved on a ball lying on its back and also without being held securely. As we can see here, the child's abnormal muscle tension and movement patterns are increased by this. This is an abnormal and unsecure posture, which makes the child feel afraid. We can move the child or bounce it on top of a ball, but have to take care while doing this that we support it sufficiently. For this, we can hold it at its arms or at its hips. If we hold it at its hips, we can also apply light pressure onto the lower spine to stimulate the child to sit straight. We must always take care that the child is comfortable and that its posture is as normal as possible, that we move it slowly while we also encourage and praise it. When the child has learned to keep its spine upright, it begins to crawl. We can stimulate this by putting some interesting objects in front of it, just beyond its reach, or by giving it interesting tasks. But also without stimulation, children want to move from one place to another. We must then give them the time and possibilities to do this, such as with this child, which is affected by cerebral palsy, especially on its left side, and which only needs minimal support. This child is not yet able to move with a walking aid. It is getting too quick for the child. Its walking is becoming unstable, and it is losing control and can injure itself. The forward movement, according to its stage of development, is crawling, even if the child cannot do it perfectly. In the next stage of development, the child starts to pull itself up for walking and finally begins to walk. Now we have to be careful not to overtax the child while playing with it, so that we don't cause any damage for it. Therefore, we must pay attention to its posture. The child should keep its upper body as straight as possible, and it should be able to carry its body weight with straight legs before we put it onto its feet. The most important preparation for walking is to train the muscles of the back, so that while walking, the upper body is as stable as possible in an upright position. For this, movements and exercises on top of a ball are helpful, with which the child stretches and turns its body in different directions. Another good preparation is to move the child on top of the ball in such a way so that it reaches the floor with its feet, has both soles of its feet flat on the floor, and carries a bit of its weight. One must pay attention that the child does not stand on its toes. This also has to be followed when using the seesaw. It should be moved very slowly, so that the child can clearly feel the flat sole of its foot touching the ground. So even on the playground equipment, we must keep the children in a good posture in order to train them in proper movement patterns. As long as the child cannot yet walk confidently on its own, it needs support by holding it at its hips or by letting it hold onto a walking aid with one or both hands. If the child can walk freely, we let it walk along a line. Or kick a ball back and forth, or walk through a ring. If we don't follow these rules and instead put the child on its feet before it can hold its weight and before it can keep its body in a stable upright position, if we don't pay attention to its posture, we may be causing damage to the child, for example, through deformities and muscle contractures, which means that a muscle shortens and the child can no longer straighten it, even when the muscle is relaxed. For all playing activities, the main thing is that it should be enjoyable for the child. The child should be actively participating and can repeat a movement sequence as often as needed. The learning effect is not achieved through the number of games played, but through the amount of concentration which the child uses for the game. For this reason, one should not interrupt the game as this father is doing. We should also not overtax the child by doing too many things at once. For example, as we can see here, by having the child bounce on a ball as well as trying to grasp objects. Or by constantly offering the child new objects too quickly, one after another. Especially disabled children need time to adjust to a new situation. Even small children know what they want, and that is their right. Movements and activities which are forced upon the child will not provide any learning effect. It is better to be friendly with the child, talk to it, touch it, and try to convince it in this way. Or to turn its resistance into a game, to calm it down, and perhaps in this way still achieve what we want it to do. It's not the children which should have to adjust to us in any activities. Rather, we should be flexible in responding to their wishes. This child, which is affected by cerebral palsy on its right side, is of course grasping an object with its healthy hand, because this is easier for him, while we want him to practice using his disabled hand. We achieve this by lightly holding his healthy hand without provoking his resistance, and by letting go when we feel his resistance, so that we do not disturb his pleasure while playing and his concentration while he explores the object. Without him noticing it, we try to guide him towards using both his hands, as he also needs to use them in his daily activities. We will not achieve anything if we exert force against the will of the child. The majority of the disabled children which we see has muscle contractures, that is, shortening of muscles due to an ongoing incorrect posture. The increased muscle tension often results in shortening of muscles, and then to a permanent abnormal posture. Therefore, especially those children are affected who are stiff. Their joint movements are limited. One can prevent contractures by not putting the child into positions earlier than what is normal for its stage of development. Here we have to consider especially the habit of many parents to put the child on its feet before it has developed far enough so that it can carry its own weight. Instead, the child should be put into various positions, and its joints should be moved as much as possible every day. When we feel contractures, we can carefully try with light pressure to stretch the muscles. While doing this, we should take care that the joints are in a straight line with the rest of the body, and that we do not twist the arms and legs. we must especially not force anything, because this can increase even more the muscle tension. It's best to ask a physiotherapist to demonstrate and to regularly correct our techniques. The parents should get thorough explanations about the exercises so that they fully understand how to do them and why they are beneficial for their child. And then they should practice these exercises every day with their child. All joints can be affected by contractures, even the hand and finger joints. In order to ensure the proper functioning of the hand for daily activities such as eating, getting dressed, and so on, from early on, regular exercises must be done. If these exercises are understood well enough, older children can also do them on their own, and mothers are able to do them correctly. They can even modify them in useful ways, as this mother is doing very nicely on her own, and integrate them into their daily routine. Contractures worsen the situation of the child even more and obstruct the child's further development. The prevention of contractures is also very important because an advanced contracture has to be treated with a cast or with surgery. We have to expect that most parents cannot afford this and that the child will therefore go untreated. While dealing with the children, we should also not forget the parents. They are the most important persons for the development of the child. The way they treat their child in daily life is crucial. Therefore, it is very important to involve them in the playing activities, to correct any damaging activities, and to suggest better ones. We should not underestimate the competence of the parents. They are capable of much more than we often assume. But for this, it's necessary that they receive a good explanation of the rules so that they understand why they should practice certain exercises with their child. Only then they can also develop their own ideas for exercises. They urgently need us to explain and talk to them in order to relieve them of their mental strain, and they are very thankful for any support we can give them for their concern about their child. For this reason, we should talk to them in a friendly and sensitive way. We should take the parents' attitudes and opinions seriously, even if we don't share them, and discuss these respectfully with the parents. For this, we must try to find a level of communication which is easy and clear for them. This video is far from being perfect or complete. It came about through experience in a concrete situation. And again, we have not discussed therapy here, but rather how to deal with the disabled child in daily life and in playful activities. This video is for conveying general guidelines as a basis for developing one's own ideas for giving the children stimulation which will help their development. For example, also by letting several children who are capable enough play together, in this way training their social skills. Everything is all right as long as one observes the described rules and always keeps sight of the whole child, and especially as long as the child is relaxed and attentive, feels comfortable, and enjoys the playing activities. This video is showing the existing situation at a charitable health center in a very underdeveloped and neglected region of northeastern India, and the efforts to treat and help the many disabled children there. It also reflects the lack of financial resources and of highly skilled staff, with the resulting limitations in diagnostic and therapeutic methods. The video was made out of the wish to convey from the perspective of a pediatrician the knowledge of the normal development of a child and of its disturbance by cerebral palsy. It aims to sharpen the perception of the parents and staff of the capabilities and needs of a disabled child, of pathological movement patterns, and of the risks of abnormal development. This video does not deal with the therapy of cerebral palsy, but rather reflects the existing situation and the observed habits in dealing with disabled children at the health center. In view of the complexity of the subject matter and of the limitations regarding time, technical means, and instructive visual material while making the video, it is far from being perfect or complete. However, it can and should give suggestions about how one can deal with disabled children in day-to-day life so that their development is improved and additional damage can be prevented, and last but not least, so that the children feel comfortable and safe. The basis for this, apart from the conveyed knowledge, is also the ability to see and respect the child as an individual person from a holistic perspective, physically, mentally, and socially. Questions, comments, and suggestions are welcome and can be emailed to renateschüssler@gmx.net, dsa1234@gmail.com. Any financial or other support for the health center is always extremely appreciated and will help us to maintain and expand our services for the disabled children and the surrounding communities. To learn more about supporting our projects or to make a donation, please visit www.rural-health-india.org.